He's also a member of our Department of Neurology and another person that I call on frequently. He's going to give us an overview of various headaches. Chris, welcome.
Thanks, John. So unlike Dr. Rowe, I'm not going to try to increase my speaker rating by telling you a bunch of jokes. On that note, I'd like to start with a joke. Do you know how to identify an extroverted neurologist? Anybody? Yeah, they stare at your shoes when they talk to you. So I'm going to talk about primary headache disorders. I don't have any relevant financial disclosures. I will say many of the medicines used to treat migraine, and that's mostly what I'm going to talk about, and other primary headache disorders like cluster headache and tension type headache do not have an FDA-approved indication for those purposes. So at the end of the talk, I hope you can better diagnose selected primary headache disorders and outline effective treatments for migraine, chronic migraine, medication overuse headache, and cluster headache. You may need one of these, Mayo's Awake tablets, which contain a fair amount of caffeine. So the first patient, a woman with 2 headaches per month and each last 24 hours. The rest are details, a lot of migraine features. I highlight in orange there the duration and frequency, because my take-home message to diagnose headache, you really need to nail down as best the patient can how frequently do they have headache, and about roughly on average how long they last. So you see this patient has a lot of associated migraine features of nausea, photophobia, and phonophobia. And diagnosing migraine is not really that difficult. It's one of those circumstances where the patient is usually correct. They do have migraine like they thought. These are the diagnostic criteria which were just updated this year. And I just bring them up, not so that you have to memorize them, but just note that you can have a bilateral, non-throbbing headache, but as long as it's moderate or severe or made worse by walking around the room, you could still be in a treatment trial for migraine. So what are the goals of acute treatment? So you want to try to minimize pain, treat the associated symptoms of nausea and such, minimize their disability, and ultimately you'd like them free of pain in 2 hours with no recurrence of headache or rescue meds within 24 hours and no adverse events. Now that's the ultimate goal. It often doesn't happen. Note I say 2 hours, not like this old migraine treatment that said migraine infallible cure in 10 minutes. We'd like that, but it often doesn't happen acutely. And long term, you want to avoid overuse of acute headache medicines, and then minimize the phone calls. And in some folks, I just try to say our goal in the next 3 months is that you don't have to go to the emergency department. Some treatment